Okay, I'll call to order the special meeting of the Community Corrections Partnership. Take roll call, starting on my right.
Pam Patterson, DA's office.
Joyce Aldrich, Workforce Development Board.
Manny Gonzalez, CAO office.
Mike Calhoun, City of Carmel, representing the county law chiefs.
Mike Moore, Monterey County Sheriffs.
Marsha Parsons, probation.
Cynthia Hassan, Deputy County Counsel.
Berkeley Brannon on behalf of DA Dean Flippo.
Frank Dice, Interim Public Defender.
Amy Miller, Behavioral Health.
Yvette Irving, Monterey County Office of Education.
Thank you. Are there any additions or corrections to the agenda?
There are no additions or corrections to the agenda.
Thank you. I think we'll start with our agenda items, and I will take public comment following each presentation of the item instead of take public comment at this time. So our first scheduled item is to receive an update on the local innovation sub-account funding. And I'd ask Finance Manager Don Sosa to give that presentation.
The report in front of you is an update to information provided at the May meeting to the CCP regarding the local innovation sub-account. We wanted to report out that the growth funds were distributed in October of 2016. They were 41% lower than previously projected by the state for collected receipts. The local innovation account has been created at the county level by the auditor controller. The funds representing the 10%, which amounts to $86,691, have been deposited into the local innovation sub-account. And we've also provided some recommendations for your consideration for future CCP meetings. And these recommendations are provided as food for thought for action later. They include probation to manage the account, much like they do the other AB 109 program expenditures on a reimbursement basis, and that CCP may direct staff to collect recommendations for gaps in service areas and use of funding. And then additionally, the last step would be the recommendation of the CCP to the board regarding the use of the funds.
So it's my understanding that these funds can stay in this account and perhaps grow.
That's correct. There is no deadline for utilization of the funds.
Thank you. Is there any comments or questions from the board?
Madam Chair, I have a quick question that, just for clarification, what is, it says on the second bullet point, it says CCP to direct staff to collect recommendations for gaps in service. What does that mean, gaps in service?
That would mean that it's some food for thought for the CCP to direct staff to collect information from the various stakeholders about service areas that might be needing additional amounts of money.
Okay, thank you.
Did that answer your question?
Yes.
Any other comments or questions from the board? Seeing none, I'll take public comment on this item. Seeing none, we'll move on to agenda item 2. Receive a presentation on the data infrastructure development. I'd ask Management Analyst 3, Robin Rodriguez, to present this item.
Good afternoon.
And I think do we need to dim the lights for this?
Oh, maybe just a little. Yes, thank you. That's perfect. So today I wanted to talk with you a little bit about our data collection and our reporting and kind of give you a status update on where we're at. For just an overview to make sure we're all on the same page, we are right now collecting data really for the purpose of understanding the impact of realignment as it pertains to our community and our criminal justice partners. We want to use that data to validate, monitor, and measure service delivery, to make informed decisions, and to evaluate the impact of supervision, custody, and service delivery, which would really be our longer-term goal. So in terms of the data that we're collecting, right now we're collecting probation data, And within that, we collect things like case counts and events, activities of supervision and different case outcomes. We have that in like aggregate totals, and we have individual level data showing all of that. In the same vein, we collect all of our AB 109 service provider data. That includes people referred, services received, all of the different service components that are offered through each of our programs and their outcomes. We also capture jail data that's including counts and totals of people in different populations. And most recently, we do collect and have now court data, which shows us new convictions and sentences. Now, we're not reporting on that data yet, and I can explain that. But at this point, we use the data in those three sources to create basic output reports, most of which I think a lot of you have seen. We publish an annual report by fiscal year. The current one that we're working on will be ready in about a month. It'll cover the 15-16 fiscal year. We're also working on our first provider report, and we publish quarterly statistical reports that keep everyone informed of the different populations that we're serving. So what we've learned over the last couple of years is that we have some significant challenges with our data, and that not all of our data is created equal. So our data sources, I think most of you know, are all independent of each other because they're representing by different county departments. So each department has its own data source, its own case management system. We implemented ETO to capture a lot of the provider data, but not all of the providers are in ETO. So we also have spreadsheets and other forms of data that we collect from different service providers. All of that data that we're collecting has to be extracted or queried out of the case management system. We take that data and we analyze it for consistency, validity, and completeness. So we can't report out on data that has obvious errors or, say, like incorrect dates or things that don't make sense or fields that aren't completed. So the data goes through a process of cleaning it and sending it back and correcting it, and then ultimately we're able to report on it. The data collected from each of those data sources has its own unique identifiers, data elements, and format. So we're learning that, for instance, when we look at the court data, that the court data has names and dates of birth and case numbers, but they don't necessarily have social security numbers or other common identifying, unique identifiers is what they're called, that we can match that back against our probation data and then match that against the jail data. So it makes it a little bit more complex when you're trying to match multiple data sources without one unique identifier. In addition, all of that data has different elements and it all comes in different formats. Each data element within each source of data has to be understood in terms of what it means and how to report it. So when we say like the number of active people for probation, that might be different than a service provider. And when we talk about things like what equals a completion, everybody has a different definition of that. So before we can report out on different data sets and different outcomes, we have to really make sure that we understand what the data means from each department and from each service provider, and that we're reporting it in a way that has validity and that it makes sense. And lastly, I think our biggest challenge that we've figured out over the last few months is that using data to report aggregate totals of people, events, or activities is really different than what's required to evaluate programs and determine the outcomes of service delivery. And I think, honestly, 3 years ago when we first started, I didn't quite understand that concept, but most recently when we had prepared this, the budget and performance documents for you guys that had the outcome measurements on it. And that was the first time that we really actually took a lot of our provider data and we took all of most of it was in ETO, and we took the amount of people that were served during the fiscal year and tried to figure out, well, if a program served 300 people, then what did that actually equal for their outcomes? And what we figured out is that, well, within that fiscal year, it was very easy to count up the number of cases that closed and tell you why they closed. But it was a whole different thing to try to tell you of the people that were served, what were their closure reasons. And when you're trying to calculate that kind of a percentage, your data has to actually be kind of organized and formatted in a way that allows that kind of analysis. So we're kind of learning that program evaluation and really looking and diving into the outcomes of services and evaluating what that all means is going to take a little more structure than what we currently have. So to give you kind of a visual presentation, like a visual map of all of this data that I'm talking about, we look at different populations. And for AB 109, we're looking at the 1170H local prison sentence only people. We have the mandatory supervision people, the high-risk probationers, and the PRCS clients. And within those categories, they all have a bunch of different services, and probation has some specific data that we want to use for evaluation, like their level of supervision, which is based on their ORIS score, any alternatives to custody that they've had, supervision sanctions, and use of EBP practices during their probation supervision. And then those people are all receiving different kinds of services. So we have all of those data sources up there represent all of the different services and programs. We've got the jail data up there, and we've got court data up there. And then we've got kind of a population of people that might not be receiving any services because they might have been the local prison sentence only people. So for all of those data sets, we can get to the outcomes of supervision, and we can tell you like why, what percentage of cases closed that were successful or what percentage was unsuccessful. And we can tell you the outcomes of programs, how many people completed. And ultimately, we'd like to be able to look at recidivism. We see recidivism as kind of the final indicator that behavior changed, right? So if somebody doesn't commit a new crime and they've changed their behavior, then we would determine that as ultimately a success. So if we can look at recidivism and we can answer questions like, how many people had new felony convictions that were supervised on PRCS versus those that were supervised on mandatory supervision? We know that people on PRCS are supervised for a longer duration of time than people on mandatory supervision. So would you see differences in their recidivism rates? Or what about the recidivism rates for the local jail time people who aren't supervised at all? And we'd like to look at all of those services that are being provided. What difference did those services ultimately make when it comes to looking at recidivism? So that's just kind of an overview of all of the different things that we have, and we have that data, but that data is all in those individual silos. So right now that data is not integrated into one like large data set where we can actually draw against it. All of those boxes represent data that's just housed in those particular areas. So right now we're reporting demographic information, counts of people, activities, events, service delivery, and outcomes relating to supervision and program completion. And that's primarily in the reports that we issue quarterly and annually. But this is really where it stops at this point. In order to move beyond this, we're going to require additional tools for how we manage all of that data. A solution to that problem is to build a little more infrastructure that would allow us to systematically manage all of those different data sets. So one option is to, on the left-hand side, I've got all of the different data sources, the primary data sources that we're using. And if you look at the cylinder in the middle, that sort of represents kind of like a data warehouse. They call it different things, is my understanding. But within that, it would mean that we would take all of that data and it would go through a process of being cleaned and it would be matched together. And that would require some significant methodology, and there's a lot of effort that goes into that process. And ultimately, the data would be grouped into what I would call like a data mart or different silos, where you could look at specific things. Like, for instance, your recidivism data is going to look at court and jail and probation data, and it's going to match that together and try to identify the starting case and then look at subsequent cases, utilizing the jail data to look at release dates. The AB 109 service provider data would consolidate ETO and the rest of the major data sources that we have. And probation data would be a part of that to kind of capture the static data and historical records that we use for reporting, so that when we're reporting annually, we are reporting data that is static and it's not shifting over time, because, as you know, over time data ultimately shifts and people go back and make corrections. So this year I might report that we had 1,000 people released on PRCS, but next year that number might be a little bit different because data over time gets corrected or it gets changed. So a model like this would allow for standardized reporting, for more statistical analysis, for research reports and evaluation, data dashboards, and it would allow us to match that data for broader research that goes beyond what we can do locally within the probation department. With this type of infrastructure established, we would have the technological capacity to identify gaps within data collection and service delivery. We would be able to examine program outcomes across all areas of service delivery. We could calculate a local rate of recidivism. So keeping in mind that in looking at recidivism, we don't have data beyond Monterey County. So if somebody leaves our county and commits a crime somewhere else, at this point in time, the state of California does not give us access to individual level data that allows us to evaluate beyond what occurs in our own county. We would be able to research the relationships between recidivism, supervision, sentencing, program, and service delivery. So that comes up frequently because we want to understand what difference the services make, and that's a question that's commonly asked in these meetings, or after I've handed out a report. A lot of times we're asked, well, how do you know at this point if services are impacting recidivism or which services are more effective? And we really can't answer that at this point. We would be able to conduct more trend analysis and look at things like changes in crime rates, types of crime, charges, changes in the populations, things like that. And we could identify outliers, so people that you wouldn't normally see if you weren't looking at your data in one large data set. So maybe specific high-risk offenders who keep hitting the system multiple times, and how do you want to handle those people that continue to offend repeatedly? Does the county want to handle them in a different way? Clients who never engage or they fall off the radar for some reason. We would also be able to identify target populations such as offenders who continue to recidivate at the highest frequency or require the highest level of service. Identify opportunities to leverage funding. So one of our challenges right now is making sure that all of our probation clients being served are Medi-Cal eligible. If they're receiving services through behavioral health, then it's advantageous that they're all on Medi-Cal. So when we share data across programs, we're able to see those kinds of things. And we'd also like to be able to use the matched data sets to collaborate with formal research institutions for additional analysis and evaluation. So this would be kind of more in line with the correlational studies and understanding the relationship between recidivism and different programs or service delivery. At this point, the probation department doesn't have statisticians on hand, so we can develop partnerships with CSUMB, for instance, or contract out for that kind of an independent analysis that takes a closer look at specific research questions. And that concludes what I wanted to share with you. So overall, I think in the last year, we've really kind of mastered what it is we collect and how we collect it. And when we implemented ETO, it very much changed our ability to collect all of that, well, most of the provider data. But realizing now that we don't have a way to take all of that ETO data and smash it together with the probation data and then look at it from that angle. We now have the court data, but we have to take that court data and merge that with probation data to actually look at recidivism. And I think we realized in this last couple of months that it's great that we have all of this data, but if we don't have an infrastructure that allows us to merge it together and house it together so that we can query against it and answer some of the questions that are commonly raised, we're really at a place where we can't move forward beyond what we're already reporting. So I wanted to bring that to everyone's attention, and in addition to that, I've also reached out to County IT to see if this is an area that they can provide assistance with. It really goes beyond our own department ability to set up a data, like kind of a small data warehouse to be able to manage this. And I'm pending input from County IT for an estimate of what they think that this might entail. I think I can have that ready by the January meeting. But we also needed feedback from this board and additional input about, for you to tell us what is it exactly that you're interested in knowing, and is this, do you want us to stay with where we're at and what we're doing, or is it preferable that we continue to move forward and actually have our data managed in a different way that allows for expanded reporting?
Thank you, Robin. Comments or questions from the board? So this is something that we need to think about between now and January to determine whether we want to move forward with what we're reporting out on right now and really do some good analysis of data. It's not going to be cheap, I guarantee you. Or we can sit back and decide this is as far as we can go resource-wise, and wait until the state tells us and funds some more reporting on AB 109. But it's just food for thought right now, but I think Robin can field any questions or, yeah, Bert.
Robin, when the infrastructure you have in mind, is that, are you thinking about software, or are you thinking about personnel, or can you describe it in any more detail?
I think to start with, it's software. So even within the probation department, we were able to utilize some of our existing servers. SQL Server, I think they call it reporting services, can be utilized to kind of house all of that data. But the technology behind that, to code it, to match it, to bring it all in, and to write the coding that actually integrates it is ends up being really, really complex, and it goes beyond what we can do locally. So we just require help in order to move that forward. When you get into additional software that allows for more advanced analytics, that might require some additional support.
Yeah. You know, and it is time consuming too. You know, at the DA's office, we do have a person that Dean funds out of his own budget. It's not CCP money. And as Robin's aware, I'm more just speaking to the board here. You know, we track folks that were sentenced to an 1170H term, and we also track people on PRCS, and we track them for recidivism measured by a new conviction. You know, because we're not having to integrate different data from different data sets, the technological challenges are less, but it's extremely time consuming, and what you're doing is you're identifying a cohort, let's say, of people who were sentenced to an 1170H term and they were released during a particular year, and you have to have some system of essentially, you know, it's figuratively, you know, following them around for a year to figure out their recidivism rate the year after release. And so in order to do that, you know, we have access to our filing data. One of the reasons I just went through that explanation is, you know, we duplicate effort.
Right.
There's no reason for it, in my opinion. You know, there ought to be a way to, and we do not, and we can't, and we would not have the personnel or the ability to drill down to do what you want to do, which is important, to look at the various programs and see the recidivism rates. So, you know, we have aggregate data, but I think if we want to know, you know, I think people should be aware. You know, you sort of just assume that, you know, since we can Google stuff, that all this information is available, and it's not. It's incredibly resource intensive to actually get performance data. And so, if we do want to compare, you know, various groups, we would have to make an investment. I do think that, you know, I would say two things. Number one, you know, this is just to give you this information. It's actually off topic. But if you look at the recidivism data for, you know, 3 years, guys on 1170H terms, guys on PRCS, the recidivism rates are pretty consistent to what we used to see coming out of the CDCR. It really hasn't changed, you know, the fact that we've moved this locally. It tends to be pretty consistent. People recidivate at about the same rates. They really do, and there are differences, but it's relatively minor. You know, what we would want to do if we want to try and do something locally is you know, compare some of the different efforts we make in terms of treatment. I agree. And I think that would be valuable. I think that we need to integrate our systems, and I just think that that we need to start talking about how to do that. So I think that's a subtopic to the overall topic, which is a valid one. If anybody wants to know what's working and what's not working, you have to do this.
And to follow up on your question about software, IT is actually proposing to manage the request and evaluate my request in-house. I think that on a more global scale, I mean, when we look at how the county moves forward as a county entity in integrating data, then I think that really does require the purchase of software.
And, you know, there was talk, you know, of creating a hub. I don't know what the technological, you can fill this in, but this would require a big investment. But the county, there was some discussion about creating, this is really for Manny, I think. We were talking about, you know, creating a hub where all of the different entities could plug in their data And then, you could, you could actually have a hub that would analyze data too. It would
Right.
match the data, so it would understand everyone's data was the same, however you go about doing that. You were talking about the identifiers, but this would identify the identifiers, and then you could do analysis off of this, but it's very expensive.
That is correct. And in speaking with IT also, I've also learned that while we have county partners who are already doing this, social services and behavioral health have made tremendous strides in matching data sets and working collaboratively. Our county IT is still kind of scratching the surface of that, and they're more than willing to provide assistance. And I think even building off of the efforts that have already been made. So I think that that's positive, but I also learned that county IT is not getting a lot of requests from all of the different departments on asking for this type of thing. So I think I was told that the request that I put forth as a project in this last month was, I think, the only pending request with IT for assistance with data integration and warehousing.
Robin? Is it
Yeah.
Robin? Can I just add one thing? So I'm a member of the SBISS, which is the South Bay Informational Sharing System. It's the 4 counties, Monterey, Santa Cruz, San Benito, and Santa Clara. And maybe reaching out to them because they're talking about the same data warehouse of all the counties working together for one integrated system. I think if they have a platform that they're actually looking at, maybe tying in or at least connecting to the people that work on that will help you. Because I do agree we need to communicate in all aspects and facets of what we're doing, because we are duplicating a lot of our efforts, and that would really help. And that would I mean, we would have the information that you're looking for. So I can get you in touch with the person
Sure.
that's in charge of that, but I just recommend that.
That would be great.
Manny?
Yes, I think the word that Burke was looking for was interface. So anyways, but I actually have had discussions with the interim IT director about this issue, and I will see what I can do to help. But with the chief mentioning that, there might be another option to look at to create some, if there is somebody out there working on hoping that they collect the same kind of data that we're looking at. I would assume so, but I don't, it may not be the same, but it could be pretty close. But I think that would be definitely something we should look at to see what options to partner up with other counties. So I'll do that.
Thank you. Any other comments from the board? Robin?
Robin, do you know if any other counties are doing what we'd like to do? And is that an opportunity for us to, purchase their software? They may have done the hard work already. It may be easier for other counties to follow them.
I don't think it's quite that easy. I can tell you that other counties, I think they started with more infrastructure to begin with than what we have in this county, whether it be within their own probation departments or it be within their county at large. San Joaquin, for instance, has what they call a data co-op, and they seem to function in a broader capacity than their probation department, but they're able to do some amazing things with what they do, and they do it as a collective. Some of the other counties have different things in place, but when I talk with them, I learned that they have some similar structures. A lot of it, though, seems to depend on the size of the county, the staff that they have dedicated for research and analysis. There are counties that have full research teams within their probation departments, and there's counties that don't have anything, and they're still at a place where they collect counts of things and report them verbally, kind of like we used to do in the very beginning of realignment. Everybody would come and verbally say the number that they had to say, and that was kind of the end of it. So I found where there's a lot of variation, and I think it's hard to build off of existing platforms or software, because I have learned that every county collects things differently. They call things different names. They define it differently. There's a lot of software options out there that do a lot of these things. I think Elliot can speak to some of that and has researched a lot of that. But I think that there's options available. It's just an area that Monterey County has not made a lot of progress in over the last 5 years. So some of it is consideration for the CCP and the criminal justice partners, with our shared criminal justice specific data, but it also has ramifications for the rest of our data and the rest of our departments, because we do include health data and social services data, and we all touch all of those systems. So I think really some of the consideration is, where does the county want to be in 10 years? Do they want to still be here where we're at? Or do they want to actually implement something that helps us move forward? And whether that's on the small scale or that's on the larger scale, it's still something for consideration, because anything that we do within the CCP and for our purposes can also impact beyond that.
Robin, sorry for being late. I had another meeting that I'm coming from, but I don't know if you mentioned kind of the intersection with the data needs under whole person care, because I think that's probably one of the, if we are doing things ideally, we're leveraging each other, right? So whole person care is a health waiver that looks at really, in general, high-cost patients, but included in that application are, costs of incarceration, costs of public assistance are part of the concept to bring in. Can you find high-cost folks and put case management around it? It's more focused on homelessness, but it goes beyond that, and I think that's, being able to leverage that effort is where I think that's important, and being able to make sure that we can, as a CCP, where there's kind of places to build on that, would probably make the most sense, but we probably need a kind of a full presentation also on, how would that intersect? Where is that process as well? Because I think you can export a system from another county. There are different counties that have different levels of data development. None of them are as satisfying as a salesman will tell you they are. But part of it is trying to build in what we need as well.
Any further comments, questions from the board? Thank you, Robin. Very informative. Hang on a minute. I'll take public comment on this item at this time. All right, seeing none. Thank you, Robin. We're moving on to our BSCC survey that is attached in your documents. It is due to the Board of State and Community Corrections by December 15th. Just a couple of weeks away, believe it or not. Are there any questions or comments on the BSCC survey? Do you need to read it, or are there any questions? Do I have a motion to approve?
So moved.
Second from, can we have a second from Chief Calhoun instead? I'm sorry. Chief Calhoun, second. Any further discussion or questions? All those in favor say aye. Aye.
Aye.
Opposed? Abstain? Thank you. And the last item on our agenda is the reserve policy. There's a draft of the reserve policy in your packet. Dawn, do you want to give a short presentation? Sure. Thank you.
So at the last meeting in November, you were presented with a need to establish a reserve policy, and you're also provided a draft policy statement. After reviewing the different methodologies, staff is recommending option A, which is in your handout, as the calculation for the reserve, which is 15% of the annual operating revenues. We've inserted that into the draft policy statement for your review. We've made 3 key recommendations. That's one of them. The other recommendation is to select option A, adopt the proposed reserve CCP policy, and to implement the policy effective for fiscal year 16-17. That lays the groundwork for planning for the remainder of what's in the reserve balance, how to allocate that.
Thank you. Comments or questions from the board on the reserve policy? Comments or questions from the public? Is it the CCP's desire to approve the 15% of the projected annual operating revenue? Do I have a motion to approve?
Second.
Second by Elliott. Motion by Chief Moore. Do I need to read this out? So I want to make sure we get this right.
Option A, right?
Option A, so it would say at minimum, the level of the reserve is equal to 15% of the projected annual operating revenue for the current year. Is that everybody's understanding? Yes. Okay, we have a motion and a second. All those in favor?
Aye.
Opposed? Abstain? Thank you. So we're coming up in January with our annual budget workshop. I think it's the first one we've had. We have some decisions to make at that time, and it is now scheduled for January 9th, 3:30, right here. Anything else from the board before we adjourn? Thank you very much. We stand adjourned.